It's a pleasure to be here this afternoon. Good afternoon to everyone. Today at this forum, I have the pleasure and the honor of welcoming a very special guest to engage in a conversation with me on a lot of different things that Valerie touched upon in the introduction. Through the opening dialogue, it is my pleasure to welcome and call on stage Ms. Afshan Khan. Afshan Khan serves as the United Nations Assistant Secretary General and coordinator of the Scaling Up Nutrition movement, leading the UN's Global Nutrition Agenda. With over 3 decades of experience in international public service, Ms. Khan has consistently advocated nutrition-focused policies and programs across development and humanitarian contexts. She has supported national governments in implementing evidence-based nutrition strategies from infant and young child feeding to combating acute malnutrition in crisis settings. Her leadership has brought together governments, civil society, and the private sector to drive investments in nutrition and strengthen systems for long-term impact. Ms. Khan's expertise reflects a long-term commitment to improving global nutrition outcomes. Afshan, may I please call you on stage? Thank you so much, Afshan, for joining us today. May I kick off this conversation by recollecting that we just had the Nutrition for Growth Summit in Paris in March, and the Sun movement was a key driver summit. And of course, you were there as one of the lead figures coordinating the summit. For those in the room who might not be aware of it or familiar with it, could you start by telling us what was at stake at the summit? What kind of commitments emerged from it? And we understand that it brought together governments, civil society, and the private sector. What were the expectations going in, and did they deliver?
Thank you very much for the opportunity to join you, and thank you for making this conversation possible. I think N4G was really a seminal moment. If I look at the work that the Sun movement did alongside the government of France and Côte d'Ivoire as the chair of the International Advisory Group, and many of the UN agencies who had helped lead the substantive work and the technical discussions for N4G, we saw it was both an opportunity to highlight how nutrition impacted many other sectors. And I think when Valerie did the introduction, she was so clear that malnutrition still causes half of the world's deaths in children. And sometimes that's not well understood or well known. But malnutrition also impacts a whole lot of other things: human capital development, longer term, workforce productivity, the ability of countries to actually invest long term in their economies. But I think N4G, its success was built around the fact that we had very strong civil society participation, a whole village of solutions that was supported by the European Commission, a day dedicated to best experiences from civil society partners organized by Action contre la faim. The Sun movement was there strongly, both with civil society agencies that are part of the movement, many entities, but I would note exceptionally the work of World Vision and the Nutrition Dialogues, bringing together youth to speak eloquently about what they felt now vis-a-vis the current situation they're facing in the context of the intersection between nutrition, health, climate changes, and conflict, and how that was impacting their lives now, but their futures and that of their families. And then there was a full day dedicated to working with the private sector. And again, here, partners from the Access to Nutrition Initiative and GAIN, along with the Paris Peace Forum, really organized together the potential to look at the role of small and medium enterprises, as well as larger national businesses, in influencing nutrition outcomes in countries. And that's partly because we know in order to transform what people eat so that we're able to address all forms of malnutrition, both undernutrition, with the right kinds of quality, nutritious foods available at an affordable price, as well as having foods that are low in trans fat or sugars, are a really important component of being able to make sure that how we influence what people eat has to be influenced by what companies are putting out there on the market. And in that sense, I think Nutrition for Growth both created a comprehensive picture of what are some of the key levers for change, whether it was the Civil Society Forum, whether it was the Village of Solutions that looked at innovations that were being made around nutrition, on the collection of data, on the collection of information, on the ability to deliver using drones or other technologies to hard to reach last mile areas. There were solutions that were put forward on the table that allowed us to leapfrog some of the challenges that are currently faced by nutrition partners. And then I would also say that I think the other opportunity that Nutrition for Growth provided, and we mustn't forget how key this is to put a political focus on nutrition. Far too often it's seen as a niche area in either health, and often due to the very good, solid work that has been done by health advocates, whether it's on the importance of breastfeeding or infant foods and the quality of those infant foods. But we also need to see a strong connect to the public policies that are formulated, and it's whether those policies are around financing, whether it's around public procurement, whether that's for schools or healthcare centers or hospitals. And we have to see changes also in the regulatory frameworks of how foods are imported, what foods are taxed, and what foods are produced in country. And the agricultural component of that becomes increasingly important, both due to climate change and, as many of the speakers have highlighted in the last couple of sessions we've had, side sessions, is really to focus on looking at agricultural productivity, giving the right mix of both cash crops and availability of food for the farmers and those that are producing the food. So in a sense, the Nutrition for Growth Summit helped connect the golden thread of the importance of nutrition for long-term growth and development of children, for health of women, and in particular, but also communities, and also the economic imperative that nutrition brings to building human capital. I would also say Nutrition for Growth was a tremendous success because you asked the question. Initially, I think in the current donor environment, there was a real risk that it would fall far short of commitments compared to some of the previous summits, whether London or Tokyo. What we saw with the current Nutrition for Growth Summit was there was $27 billion pledged in commitments. The big shift, I would say, from Tokyo was those commitments were not largely, but I would say significant shifts in that they came also from international financial institutions. The African Development Bank, the World Bank were big commitment makers. So was the European Commission, and the European Commission, I think, has been instrumental in some of the financing for nutrition, and we hope that will continue. But Paris was landmark in terms of countries, philanthropies, and institutions all stepped up to make significant commitments. And those domestic budget announcements that were made and mobilized by several sun countries, we want to make sure that those commitments to action, both in terms of clear national plans that were presented, but also in terms of domestic budget commitments, can now be leveraged to obtain additional financing, whether that's complementary financing from philanthropies, international NGOs, or from the IFIs. We see a real opportunity to emphasize and stress more that an investment in nutrition has a $23 rate of return one for each dollar, as estimated by the World Bank. So here we see an opportunity to show the power of nutrition and its ability to transform societies. And you may say, well, why is this important? I mentioned the 50% child death figure, but the longer term impact also of not investing in children, in particular those first 1,000 days, are lower capacity in learning, a lack of cognitive growth and development. The impact on women can be 1 in 3 women in the world now suffers from anemia, can be shortage and difficulties in their own health, but the health of their children when they're pregnant, and longer term, their impact on productivity. And I would also say, perhaps to end, that in a way, what we got at the Nutrition for Growth Summit was a stronger compact and integration of nutrition across sectors. I think both the UN agencies that helped organize some of the substantive sessions and the French government really brought about a strong understanding about how important it is to integrate nutrition in different sectors, whether that's health, whether that's social policy, whether it's agriculture, or whether it's water and sanitation. And I think the other piece, I think, came out quite strongly, and I was very happy to see the voice of Sun countries there, is the emphasis also on longer term, what needs to be done around prevention. Because prevention of malnutrition, and that's malnutrition in all its forms, whether it's stunting or overweight and obesity, is going to be able to save resources longer term from government budgets, whether it's responding to crisis or whether it's the health budgets. So in overall fact, I think Nutrition for Growth raised the bar on how we see nutrition influencing longer term development outcomes. But there's a lot to be done, and many of the partners in the room here will be so important to that, to make sure those pledges and commitments turn into action on the ground at the country level, so we're able to see the impact we want to see, including with the nutrition targets, on tackling all forms of malnutrition, on improving the rates of stunting, wasting, overweight, and obesity, making sure all of those targets are met and reduced, and also to really make sure that we see continued support to countries to move the agenda forward.
Thank you so much, Afshan, for that really comprehensive overview over what came out of the Nutrition for Growth Summit. And I think that it's a milestone in itself in terms of marking commitments, bringing the private sector, connecting the international framework to local action, to driving countries. I'm also at the same time cognizant of the fact that the summit came at a very challenging time in itself, at a time where there's massive rise in conflicts, polarization, to a time where there's a massive cut in international development assistance. And so just from that, and since you were also mentioning a host of commitments, are there also any challenges that you see coming up, the challenges in implementation of the commitments over the next few years? And are there any particular bottlenecks, say financial, political, or otherwise, that you think deserve more attention for the next few years?
Thank you. I think in the current environment, this is a really important question. Last Friday, there was a report launched on what the impact of some of the funding cuts is going to have on malnutrition, and particularly in humanitarian contexts, and the impact of that food crisis that we're seeing in several countries connected to both conflict and climate. The cuts that have been made in budgets, and often the US is cited as one example, but I think we're facing an overall challenge around development assistance as a whole. And nutrition is also clearly impacted by that. Valerie raised the situation in Gaza, but the situation in Gaza is perhaps one of the most visible and stark, because it's clearly a man-made crisis, as is Sudan, as is Yemen. But if we look at the intersection of conflict and climate and the budget cuts now, we're likely to see far less investment in nutrition, and the impact of that goes beyond statistics and figures. We know that, for example, we've been monitoring with other partners immediate impact of some of the budget cuts. And those budget cuts, yes, they affect some of the development partners, but they've also cut the available investments that governments have in countries. So, for example, in Kenya, more than 600,000 people living in areas plagued by drought and acute malnutrition will lose access to life-saving food and nutrition support. Services in Sudan are going to be cut. The Standing Together for Nutrition Consortia estimates that aid cuts of around 44% are threatening really decades of progress that have been made in nutrition. And 2.3 million children could lose access to life-saving treatment, and up to 60% of these children may not survive without interventions. So the long-term projections on death as a result of some of these cuts are stark. So in a way, we have a real challenge, and it brings it back a little bit to this nutrition integration, to look at how can we help bundle and deliver services in a far more efficient way. I see Claudia Hudspeth in the room. We've been working with Gavi, Aga Khan Foundation, and Sun to see what can we do to make sure some of the immunization services are bundled in a better way, so that when a child is vaccinated, that same child is screened and treated if needed for malnutrition. So the bundling of services and some of the efficiency gains that can happen as a result of those interventions is key. Earlier, I spoke about the integration of nutrition across different sectors. When we look at water and sanitation, it's another area. I just came back from Côte d'Ivoire. I was on Sunday. There, they've set up a system called the franc, like the coin, like the money, sorry. But here, we see also there's an opportunity if we integrate better water and sanitation, social protection, nutrition counseling, breastfeeding counseling in an integrated way, we'll be able to see better outcomes for nutrition. So the more government can work towards an integrated multi-sectoral plan with investments in health, in food security, in social protection, in water and sanitation, and education, the better we'll see nutritional outcomes in a more efficient way and at a lower cost.
Thank you for that overview. From what it seems to me, a lot of integration, a lot of coming together is required. Which brings me to my next question, is that we're having this conversation in International Geneva, which is really a hub of multilateral action, be it in health, humanitarian affairs, or human rights. In your view, what is the role that International Geneva could or should play in advancing global nutrition agenda? And also to put forward a little bit of my due interest, which is how can we better connect the global policy infrastructure to the needs and voices of young people who are not only beneficiaries, but also key stakeholders in this process of more equitable and sustainable, not only food systems, but also the nutrition agenda. How do you see this connecting?
Thanks so much. I want to recognize some of the colleagues that are here that have very much helped with coming together around Geneva and the nutrition dialogues. I do think there's a real opportunity with Geneva as a hub for health, for some of the innovation that we're seeing. We're here on the health campus. I also spoke already about Gavi, but I also want to highlight the trade piece, because increasingly that's becoming very, very important. And Geneva is also the center, and you're a clear example of that, of many young people coming together. And I think when I look at innovation, transformation, change, youth voices, energies, and ideas are essential in that fight against malnutrition. At Sun, we've had a number of partners who've worked on youth-led advocacy, transforming communities and driving policy change. We've seen this in Zimbabwe with the Zimbabwe Civil Society Organization for Scaling Up Nutrition Alliance. They launched a youth-led advocacy campaign on adolescent nutrition. The campaign engaged school-going adolescents in promoting healthy eating, physical activity, and contributed to national school nutrition guidelines. At N4G, we saw the 4SD group work with French schools to bring them into the engagement around the N4G summit. So I think really here we see Geneva as a hub for several international activities, but there's also an opportunity to engage far more effectively with young people on ideas for innovation. And I'm glad we're here at the Biotech Hub, because here again, I do think there's an opportunity, and the NGO community and presence has been so strong as well. I see Christine Campo here from CARE. And here again, I think there's an opportunity to say, how do we bring NGOs with their vast networks of competence to work together in a way that allows us to work alongside young people, civil society, the best that the UN system and government technology and innovation has to offer to really create a transformational landscape for changing the face of malnutrition. Thank you.
Thank you, Afshan. That's a very, very encouraging agenda, and particularly for a fertile ground like Geneva, which is really about bringing people together and taking forward young people, stakeholders, civil societies, and NGOs together. I would maybe turn to the floor to take maybe one or two questions, if there are, for Afshan, and then we can move forward. Yeah, I see you had there. I see a hand there.
Thank you very much. Thank you for this great update on the nutrition for growth. And I think one of, my name is Prathit. I work for the Committee of Food Security in Rome. I think one aspect that was mentioned is the importance also to focus on what's going on in emergencies and nutrition in emergencies and protracted crises. The Committee of Food Security is a body that is hosted by FAO. I see some colleagues from FAO here. We are made of 130 member states, civil society, private sector, and also foundations. And we do produce and publish a number of policy and guidelines that we hope that will be uptaken by the countries. And when you say why Geneva, I think there is one aspect that we don't talk a lot about is the right to food and to nutrition. And I think this is also an opportunity to highlight these issues in terms of improving and guaranteeing access to food and nutrition to everyone, leaving no one behind. Thank you.
Thank you for that.
Thank you so much for also raising the right to food. You're absolutely right. I think Geneva, both as a humanitarian and human rights hub, brings a huge opportunity to continue to advocate strongly for those rights, and particularly as we're seeing more and more in humanitarian contexts, that right consistently being violated. So thank you for raising it, Fatima.
Thank you so much. And looking at the time, I think this is the time that we move on from the opening dialogue and delve into the panels at hand. But before that, thank you so much, Afshan, for that really insightful opening and a very encouraging start to what is going to be exciting Geneva Health Forum.
Thank you.
And thank you so much. I pass on to you, Valerie.